Gun Tan Wan, commonly translated as vaporized phlegm pill, is a classical traditional Chinese medicine formula in the category drain heat and drive out phlegm. Its core action is to drain fire and vigorously expel stubborn phlegm heat. The pattern framework is excess phlegm fire with severe obstruction or Shen disturbance. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is excess phlegm fire with severe obstruction or Shen disturbance. Typical clues include thick phlegm, chest oppression, constipation, agitation, red tongue, slippery rapid forceful pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Mangshi, Da Huang, Huang Qin, Chen Xiang. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses Da Huang and bowel-active medicines. Rhubarb-containing formulas can increase bowel motility and fluid loss. Combining them with stimulant laxatives, bowel prep agents, or medicines that already cause diarrhea can increase dehydration and electrolyte disturbance. Rapid intestinal transit can also change absorption of oral drugs. Persistent abdominal pain or bleeding should not be treated simply as constipation. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses timing with oral medicines. Mineral-rich ingredients, such as gypsum, oyster shell, dragon bone, hematite, or similar substances can complicate oral drug absorption through binding, altered gastric chemistry, or simple co-administration effects. For medicines with narrow absorption windows or known mineral interactions, separating administration times is a conservative strategy unless a pharmacist or prescriber gives different instructions. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. This is a strong purgative and phlegm-draining formula. Avoid unsupervised use, especially with dehydration, bowel disease, or altered mental status. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Gun Tan Wan is best understood as a pattern-based prescription, whose action is to drain fire and vigorously expel stubborn phlegm heat. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen and Current drug interaction and pharmacology references.